Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, doctor. I'm here today because I'm still having these terrible headaches, and I feel like we haven't gotten to the bottom of this maxillary cyst issue yet.
Good morning. I understand your concerns. Let's take it step by step. Tell me more about these headaches.
Well, they started not long after the cyst removal attempt. They're mostly around my forehead and the side where the tooth was extracted. I was given sumatriptan, and it helps, but I feel like I shouldn't be needing to take it so frequently.
I see. How often are these headaches occurring?
Almost daily now. It's affecting my ability to work and even sleep. And about the surgery, I felt everything during the procedure. It was uncomfortable and quite distressing. I'm not very keen to go through another surgery under local anesthesia.
I understand your concern about the anesthesia. It's also troubling to hear about the discomfort you experienced. Have you noticed any other symptoms, like swelling or changes in sensation around the area of the cyst?
Yes, there's been some swelling, and occasionally it feels numb. Also, I'm unhappy with how the surgeon handled the whole procedure. The fact that they didn't send the removed material for pathology bothers me. It feels like we might have missed something important.
That's a valid concern. Sending samples for pathological analysis is standard to ensure everything is accounted for. Now, tell me a bit about the hernia issues you mentioned.
The hernia repair was years ago, but it occasionally still causes pain, especially when I'm active. It's not as severe as the headaches, but it's there.
Okay, that helps me understand the full picture. Have you been able to manage this pain with your current medications?
I use naproxen for the pain, and sometimes I've had to use Vicodin. I try not to take it unless it's really bad.
It's good that you're cautious with the pain medications. Have you noticed any improvement in your health since quitting smoking?
Yes, definitely. My breathing is better and I don't get winded as easily.
That's excellent progress. Let's review your clinical details now. Your blood pressure is 130/85 mm/Hg, which is slightly elevated. Heart rate is stable at 72 BPM, and your respiratory rate is normal at 16 breaths per minute. Your temperature is normal, and your weight and height are consistent with what we have on record. Looking at your lab results, everything appears to be within normal ranges. Your liver and kidney functions are good, and there's no indication of infection or inflammation from the CBC and CRP levels. Your imaging studies, however, do show a recurrence of the cystic lesion near the extraction site. Given all of this, let's talk about the next steps.
Please, I just want to feel better and avoid any more of those painful procedures if possible.
Absolutely, I hear your concerns. Based on everything you've told me and the results we have, here's what I suggest. First, we need to manage these headaches more effectively. I will arrange a refill and consider if we need to adjust your pain management strategy. Secondly, we will refer you to an oral surgeon with full surgical privileges, someone who can handle your case with the right level of care and expertise and under better anesthesia. This surgeon will likely request a new CT scan to get a detailed view of the cyst, and I want them to manage it appropriately, possibly with pathology to follow up.
And what about the hernia?
For the hernia, I recommend a follow-up with a surgeon to assess whether there's been any change that requires intervention. It's important to manage that proactively to avoid complications.
Okay, that sounds comprehensive. How soon can we get these referrals and appointments set up?
I'll start the referral process today. Our staff will help coordinate with the specialists and ensure you get the appointments as soon as possible. We'll also arrange for your medication refills to be ready for pickup by the end of the day.
Thank you, doctor. I appreciate you helping me sort all this out.
You're welcome. It's important to address each of these issues thoroughly. We want to ensure you get the best care possible. We'll keep a close eye on both the cyst and the hernia. Make sure to follow up with us after your appointments with the specialists.
I will. Thanks again for everything.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've noticed that even though I'm not trying to lose weight, my appetite just isn't what it used to be. I'm eating less, and I think that's why I've lost some weight recently. It's not something I planned.
I understand. Changes in appetite can be concerning. Have you noticed any specific times when your appetite decreases, or is it constant?
It seems pretty constant. I just don't feel like eating much anymore, and nothing really appeals to me. It's strange because I used to enjoy my meals.
And what about your energy levels? Have you noticed any changes there?
Yes, actually, I feel more tired than usual. I thought initially it was just from not eating well, but it seems more than that.
Okay, that's important to note. Let's also talk about your other symptoms. You mentioned having pain and pressure in your left testicle.
Yes, that's been quite bothersome. The pain comes and goes, but it's definitely more frequent now. It's somewhat relieved when I urinate, but it's starting to worry me.
I see. We'll definitely get that looked at with an ultrasound to understand what's going on. You also mentioned increased shortness of breath, especially with activities like climbing stairs.
That's right. It's been getting worse. Before, I could manage stairs fairly well, but now I find myself having to stop halfway to catch my breath.
Thank you for sharing that. It's important we look into that further, especially given your history of atrial fibrillation. We've scheduled a stress test to evaluate your cardiac function under exertion.
I remember you mentioned that last time. I'm glad we're checking it out.
Absolutely. It's better to thoroughly assess these symptoms sooner rather than later. Now, regarding your chronic conditions, How have you been managing with your arthritis and your sleep apnea?
The arthritis is as usual. I have good days and bad days. The tramadol helps, but some days the pain is still pretty sharp. As for the sleep apnea, I admit I haven't been using the CPAP machine as regularly as I should.
I understand it can be challenging, but regular use of the CPAP machine is crucial for managing your sleep apnea effectively. It might also help improve your energy levels during the day.
I'll make more of an effort with that. It's just cumbersome, you know?
Yes, it can be at first. Many patients find it becomes easier over time. Now let's go over the lab tests we're planning for today. We're going to check your hemoglobin A1C to see how your diabetes is doing, along with your lipid profile and alpha-fetoprotein, given your history of hepatitis C.
Sounds good. How often should we be monitoring my liver function now with the hepatitis?
Given your current liver enzyme levels and your condition, we should continue monitoring it every 6 months, unless we see something that needs closer attention.
Got it. And the medications? Are we making any changes today?
For now, we'll continue with your current prescriptions. I want to see the results of today's tests and the upcoming imaging studies before making any adjustments. We'll reassess everything when you come back for your follow-up.
Sounds like a plan. I appreciate your thoroughness, doctor.
Of course, it's important to stay on top of these things. Here's what we'll do going forward. Continue with your current medication regimen, complete the lab tests today, perform the ultrasound on your left testicle, and conduct the stress test. After we have all the results, we'll have you back in 3 months to review everything. If you have any concerns in the meantime, please don't hesitate to contact us.
Thank you, doctor. I feel better knowing we have a plan in place.
You're welcome. I'm here to help. See you at your next appointment, and we'll take it from there.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
To develop an effective pain management plan for our elderly patient, we should start with a balanced approach. Given her history of gastric issues, would you suggest starting with a low-dose acetaminophen regimen?
Yes, a low-dose acetaminophen is a good start, considering her sensitivity to stronger NSAIDs. On top of that, what do you think about incorporating some non-pharmacological strategies? Physical therapy could be beneficial to address her mobility and reduce pain.
I agree. Physical therapy would definitely enhance her quality of life. I think we should consider acupuncture or even massage therapy more, as both have shown promise in managing pain without the side effects of medications.
That's a great idea. We also need to consider her mental well-being. Including a psychologist in our pain management team could help address any psychological impacts of her chronic pain.
Absolutely, a holistic approach is crucial. Let's also ensure that we monitor her response to the plan closely and adjust as needed. We can schedule follow-up appointments initially once a week to make any necessary adjustments.
Now look at question 26.
Discussing ethical dilemmas, one of the most difficult we face involves allocating limited resources. How should we approach this, especially in times of high demand?
Ethical frameworks guide us to prioritize fairness, equity, and transparency. We need to engage with the community and explain how and why these decisions are made, which is crucial for maintaining public trust.
Indeed, communication is key. Another complex area is handling end-of-life care. Balancing between medical recommendations and the patient's personal and family wishes can be very challenging.
Absolutely. We must strive to ensure dignity and respect in end-of-life care while being mindful of the emotional and ethical weight of our decisions. It's about compassionate care as much as it is about clinical care.
Yes, and continuous education and ethical training for our staff can help navigate these situations. It's important for healthcare providers to feel supported when faced with such tough choices.
Now look at question 27.
Can you describe the symptoms you're experiencing right now?
It started with a sudden onset of sharp chest pains about an hour ago. It's been getting progressively worse and I'm extremely concerned.
I see. It's good that you came in immediately. We'll start with an ECG and get some blood tests done to understand what's going on. Have you experienced anything like this before?
No, this is the first time, and it's frightening. How long will the tests take? What are the next steps?
We'll have the initial results from the ECG in a few minutes, which will help us decide if further, more detailed assessments are needed. Our priority is to stabilize you and make sure we understand the cause of your symptoms. You're in good hands, and we're going to take care of you.
Now look at question 28.
Let's ensure we're all on the same page for today's procedures. First up, let's reconfirm the patient's identity and the details of the scheduled procedure.
The patient is John Doe, here for a right knee replacement. His ID matches, and the surgical site is correctly marked. We've completed all our pre-surgical checklists.
Great! Has the anesthesia team completed their pre-op assessments?
Yes, they've just finished. The patient has been informed of the procedure and anesthesia risks, and he's consented. All equipment checks are also complete.
Excellent. Remember everyone, let's keep the communication lines open during the surgery. Immediate reporting of any issues is crucial for patient safety.
Now look at question 29.
Our ICU is currently over capacity, and we need to make some difficult decisions regarding bed allocation. Let's prioritize based on clinical urgency and potential for recovery.
I agree. Patients who are likely to recover with intensive care support should be given priority. This aligns with our duty to save lives and use resources effectively.
Absolutely, and we must ensure that these decisions are made transparently and ethically. It's important to document all decisions and the reasons behind them.
Yes, and let's also set up a review mechanism to reassess our allocations regularly. This will help us adapt to changing situations and needs.
Now look at question 30.
Given your history of early labor in past pregnancies, it's important we discuss preventive strategies for your current pregnancy. Progesterone supplements are one effective option.
I've heard about progesterone but haven't used it before. What exactly does it do, and are there any risks?
Progesterone helps maintain the pregnancy and can significantly reduce the risk of premature birth. The side effects are generally mild, like nausea or headaches, but will monitor you closely for any adverse effects.
That sounds reassuring. Are there other things I should do alongside the progesterone?
Absolutely. Maintaining a healthy diet, reducing stress, and avoiding strenuous activity are all important. Regular checkups will also help us catch any potential issues early.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Good morning, everyone. Today, we will delve into a complex topic that combines the fields of neurology and psychiatry, focusing on the intriguing intersection of epilepsy and psychiatric disorders. This exploration is rooted in understanding the bidirectional relationship between these conditions, emphasizing the impact on treatment protocols and patient outcomes. We'll begin by examining a case study which highlights the challenges and innovative approaches in managing comorbid epilepsy and psychiatric disorders. Our case involves a 34-year-old patient named John, diagnosed with temporal lobe epilepsy, TLE, at the age of 20. John's medical journey provides a profound insight into the complexities of treating neurological conditions alongside mental health issues. Over the years, John struggled with managing his epilepsy, which was complicated by intermittent episodes of anxiety and depression, common comorbidities in patients with TLE. Research from Harvard Medical School suggests that the limbic system, which is often implicated in TLE, plays a crucial role in both emotional processes and seizure activities. This overlap explains why psychiatric disorders are prevalent in patients with TLE. A study published in the Journal of Neurology, Neurosurgery, and Psychiatry indicates that up to 35% of patients with epilepsy will experience significant psychiatric conditions at some point in their lives, with mood and anxiety disorders being the most common. Let's consider the neurobiological underpinnings pertinent to John's case. The temporal lobe is integral for both seizure activity and emotional regulation. Seizures originating in this brain region can disrupt neural circuits involved in mood control, leading to psychiatric symptoms. This disruption poses significant challenges in distinguishing between neurological symptoms and those caused by an independent psychiatric condition, which is critical for effective treatment. John's treatment regimen included anti-epileptic drugs, AEDs, specifically levetiracetam and lamotrigine, which are known for their mood-stabilizing properties. However, managing his psychiatric symptoms required a more nuanced approach. According to a review in Epilepsy and Behavior, the choice of AEDs can profoundly affect the psychiatric outcome in patients. For example, while some AEDs have mood-stabilizing effects, others may exacerbate psychiatric symptoms. In addition to pharmacological treatment, John participated in cognitive behavioral therapy, CBT, to address his anxiety and depressive symptoms. CBT is endorsed by several Harvard-led studies as an effective treatment for mood disorders in epilepsy. This dual approach of medication and psychotherapy aimed to stabilize his mood and control seizures, but John's case was particularly challenging due to the fluctuating nature of both his seizure activity and mood states. Throughout his treatment, John experienced periods of seizure exacerbation, which often correlated with spikes in anxiety and depressive episodes. This observation is supported by literature indicating that seizure exacerbations can often precipitate psychiatric symptoms, suggesting a shared pathophysiological pathway. To further complicate the clinical picture, John faced several side effects from his AEDs, including cognitive dulling and fatigue, which mimicked and possibly worsened his depressive symptoms. This interplay between drug side effects and psychiatric symptoms necessitates a careful and dynamic approach to medication management, a principle highlighted in the Harvard Review of Psychiatry. In light of these complexities, our treatment strategy for John evolved to include a more integrative care model. This model emphasizes the collaboration between neurology and psychiatry, aiming to tailor treatment approaches that address both seizure control and psychiatric stability. Recent studies advocate for the use of integrative neuropsychiatric clinics, which can provide a more holistic approach to such complex cases. John's ongoing treatment highlights the necessity of a multidisciplinary approach in managing epilepsy with comorbid psychiatric disorders. It underscores the importance of personalized medicine, particularly in neurology and psychiatry, where the interplay between brain and behavior necessitates a nuanced and patient-centered treatment strategy. As we continue to advance our understanding and treatment approaches, the goal remains to enhance the quality of life for patients like John, ensuring both seizure control and mental health stability. Thank you for your attention, and I look forward to any questions you might have.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Welcome everyone to our healthcare talk today, where we will delve into a complex and crucial topic within respiratory medicine: the challenges and advancements in the management of progressive pulmonary fibrosis, PPF, and idiopathic pulmonary fibrosis, IPF. These conditions represent a significant clinical challenge due to their progressive nature and the severe impact they can have on patients' lives. We'll start by discussing a case study that illustrates the typical presentation and progression of these diseases. Let's consider the case of Mr. Smith, a 68-year-old retired construction worker who was referred to a pulmonary clinic with a 6-month history of progressive shortness of breath and a persistent dry cough. His medical history includes 20 years of smoking, although he quit 10 years ago. Recently, he's been unable to perform his daily walks due to increasing breathlessness. On physical examination, fine crackles were audible at the bases of both lungs. High-resolution CT scans showed a pattern suggestive of usual interstitial pneumonia, with peripheral, predominantly basal reticular abnormalities, and traction bronchiectasis without significant honeycombing. Given the absence of any extrinsic allergens or autoimmune features, and after a thorough review, he was diagnosed with IPF. In managing Mr. Smith's condition, it's essential to highlight the role of recent advancements in antifibrotic therapy, which have shown promise in slowing the progression of IPF. Two key medications approved for this purpose are pirfenidone and nintedanib. Both drugs work by inhibiting pathways involved in fibrosis, but come with their side effects, such as gastrointestinal issues and potential liver function abnormalities, necessitating regular monitoring. Beyond pharmacological management, it's crucial to consider the holistic needs of patients with IPF. Pulmonary rehabilitation programs can improve exercise capacity and quality of life, while supplemental oxygen therapy is recommended for those with significant hypoxemia. The psychological impact of IPF is profound, with many patients experiencing anxiety and depression due to the chronic, progressive nature of the disease and the uncertainty about their future. This necessitates a comprehensive approach that includes psychological support and palliative care to address symptoms such as refractory cough and end-stage respiratory distress. Turning to progressive pulmonary fibrosis, this condition can be considered a spectrum where fibrosis progresses despite the identification and management of an underlying cause. For example, fibrotic hypersensitivity pneumonitis or autoimmune-related pulmonary fibrosis, such as that seen in rheumatoid arthritis, can evolve into PPF. The management of PPF involves addressing the underlying disease with immunosuppressants or other targeted therapies and may also involve the use of antifibrotic agents, as recent studies suggest benefits similar to those seen in IPF. Mr. Smith's case also raises the possibility of acute exacerbations, which are feared complications of IPF and PPF. These are characterized by a sudden worsening of respiratory function, with new ground glass opacities evident on imaging and require immediate medical attention. Treatment typically involves high-dose corticosteroids, although the evidence supporting this is not robust. The management of exacerbations is a delicate balance, aiming to provide relief without exposing the patient to undue risks from treatment. In advanced cases, lung transplantation may be considered. This option requires careful patient selection and timing, as the best outcomes are achieved when patients are not too advanced in their disease course. Transplantation offers a chance for extended survival and improved quality of life, but it comes with its own set of challenges, including the risk of rejection and the need for lifelong immunosuppression. Looking towards the future, ongoing research is crucial. Emerging therapies that target various fibrotic pathways are currently under investigation, and there's hope that these will lead to more effective treatments with fewer side effects. Furthermore, early diagnosis through more widespread use of high-resolution imaging and possibly biomarkers could significantly improve outcomes by allowing earlier intervention. The management of IPF and PPF requires a multifaceted approach that integrates the latest in pharmacologic treatments with supportive care and timely intervention for acute exacerbations. It's a field that's rapidly evolving, and staying abreast of the latest research is essential for any healthcare provider involved in the care of patients with these complex pulmonary diseases. Thank you for joining this discussion. I hope it has provided a deeper understanding of the complexities and nuances in managing these challenging pulmonary conditions.